Recommendations in the fight against skin cancer is Dr. Susan Evans, Director of Dermatology from Cosmetic Physicians of Beverly Hills. Also joining us is one of her patients, Marianne Gerber, who is recovering from stage 3 malignant melanoma. Welcome to both of you. Marianne, Dr. Evans, great to see you.
Thank you.
Marianne, before we get to your story, I want to ask you, Dr. Evans, skin cancer is the most common form of cancer.
It absolutely is. There's 1 million cases of skin cancer a year, and there's more skin cancer than breast, prostate, lung, and colon cancer combined.
Incredible.
1 in 5 Americans will get skin cancer at one point in their lifetime.
So this is a message none of us can afford to ignore. We all need to be aware of this.
We have to pay attention to this.
And Marianne, your story is so important, I think, because you went to just check out what you thought was a mole, and what did you find out?
Went to a plastic surgeon because I was obviously very vain about what I looked like. So went to a plastic surgeon and had that mole removed. It was a little tiny red mole that was on my left cheek. You know, 3 stitches, no big deal, Marianne. We'll get this taken off for you. And the next week I get a phone call and it's stage 3 melanoma.
Well, thank goodness for your vanity, you just said there, because that saved your life.
Right.
But when we talk to you about what may have caused this, of course we don't know exactly what caused it, but you say that you've been using a tanning bed since you were 13 years old.
Absolutely.
How often would you go into these tanning beds?
You know, when I was that young, I actually would go in and fall asleep in the tanning bed. I would put a towel over my face and fall asleep for 30 minutes because the warmth of the tanning bed, you know, it felt great to be in there.
And your mom had one in her salon, so you could go in anytime.
Absolutely.
And this is not uncommon. The teenagers are doing this before their dances, before their proms. It's a really common thing.
Teenagers especially. Is that because you think teenagers are just unaware of the risks associated with tanning beds, or they just choose to ignore them because they're teenagers?
Well, that's the big question. Are you really aware of the risks when you go to the tanning beds? Do you really know how dangerous this is?
Right. Well, as we know, the FDA is releasing some new guidelines surrounding tanning beds today, and they are recommending that young people don't use them as often, right? Can you tell us about the recommendations?
Actually, in her case, she was not aware of it. They want signs posted showing that this is indeed a risk of skin cancer. You can get skin burns. It also causes premature aging, cataracts, and can suppress your immunity.
Absolutely. And I'm going to read a response from the Indoor Tanning Association. They gave us a comment. Their executive director, John Overstreet, told us business is already going further than what the FDA requires to make sure that people are aware of the risks. So again, the importance is that people are aware, especially teenagers. Why is it so important, Dr. Evans, that teenagers are especially aware? That's because this is the age group that can do the most long-term damage.
Exactly.
Right?
If you're introduced to a tanning bed for the first time in your teenage years, you can have up to a 75% increase of converting into a skin cancer.
Unbelievable. And Marianne, now you're okay, but this is a lifelong process for you, correct? You're going to have to do skin checks
every 6 months for the rest of my life. And I go and actually speak to the kids as much as I can now and advocacy groups to go and teach them the dangers and the risks of tanning, because they don't understand it and they're not informed. Just like I wasn't informed. I was told to follow the guidelines, do, you know, the certain things, and you're fine. As long as you do those guidelines, you'll be safe.
And you've recently found another malignant, was it a melanoma?
It was actually a precancer that was on my arm.
Precancer, okay.
And it was just another scar.
Right.
So I'll get these everywhere for the rest of my life.
Again, driving home this important message. Now, Dr. Evans, what can people do to protect themselves?
Clearly, if you have any moles or anything that's remotely suspicious, then you should get to your dermatologist. Let them examine it. Learn the ABCDs of a skin mole and what should be checked. Your doctor will explain that to you and get anything that's suspicious biopsied so you can take care of it as early as possible.
Absolutely. And I guess remember, when you're going out in the sun, hats, sunglasses, sunscreen, all of these things are necessary.
Definitely. The sun is not your friend, and there are healthy alternatives to having a tan.
I like that. The sun is not your friend. Exactly. Get a spray-on tan. Thank you so much, Dr. Evans. Marianne Gerber, best of luck to you. Thanks to both of you for being here. And remember, check with your doctor to get regular skin examinations and to read up on the new FDA recommendations regarding indoor tanning. Be sure to check out abcnews.com.